Hi everybody, it's Dr. Magnifico from jarrettsvillevetandpobly.com. This is a 1-month-old kitten. They know this because they had the parents. She was found this morning not eating, pretty quiet, pretty lifeless. Her eyes were slam shut. Since then, she's been warmed up. Really, her biggest problem, like most ill kittens, is they get dehydrated, typically from diarrhea. So you can tell she's had diarrhea. So she's weak. She's been very quiet. She's just starting to warm up, so she's just starting to get more life to her. She is significantly and severely dehydrated with any amount of vomiting or diarrhea, and typically kittens get diarrhea and/or fleas. Fleas are a big killer of kittens. They get really dehydrated really quickly. So I get a lot of questions on Pavli. I've got a sick kitten. She's not eating anymore. You know, she's like tiny. She's really bony and really tiny. She's about half the size of the rest of her litter mates. So it's time to do something for her. Get them warm, get the fleas off is the big thing. She needs fluids. There's 2 ways to give fluids, in my opinion, for kittens. So you've got to have medical grade fluids. You can't just use water. It has to be a sterile medical bag. Some people can get this from a rescue. Some people can get it from their vets. And then you either put it under the skin in between the shoulder blades. Because she's so little and because she's so bony, that's not really very easy. The other thing is I put a femoral catheter in. So the femur is the bone between your hip and your knee. It's the easiest way for us to get fluids into a kitten fast because they're so little and we can't get intravenous fluids. It's impossible to do that. So she needs to be, at this point, she needs to be dewormed. She needs to be force fed. She needs to be hydrated. She needs to be kept warm. And then she needs a lot of TLC to get her back and feeling better. But anytime you've got diarrhea or you've got an eye that's closed shut or you've got any kind of crusting around the mouth or the nose, it means there's an infection. Because the infection causes an increase in body condition, in body temperature, they're going to get really overheated really fast. And they're going to dehydrate even more. So diarrhea, fever, vomiting, parasites, any of those things really cause severe dehydration. And you will get a very sick kitten very quickly. So go to your vet, ask for some fluids. You need to do something about the diarrhea. These guys should have been dewormed before mom had them. So mom should have been on something to prevent parasites, and then you got to make sure there's no fleas and then keep them warm. She's already feeling better just because she's warm. So we're going to put a femoral catheter in, start giving her fluids over the next couple of hours, and then that will rehydrate her. And as long as we keep her warm and then get her eating, she should be on the mend. It's really not a very big deal. If you go to a vet who deals with pediatrics or neonates, they can help you. But it's just the very basics: keeping them eating, keeping them warm, keeping them hydrated. If you have a question, you can find me at pavli.com or come visit us at Jarrettsville Vet. Thanks.